Hello everyone, it's already 1st of December and on 10th you are going to face your DNB pediatric practical examination. So I hope you guys are preparing well for that exam, and we have discussed many times earlier also about the pattern of OSCE and how to prepare for OSCE. So you all are well aware about the OSCE pattern, and there are many online material also available for that. Now in last few days the main concern is about case vivas, and case vivas are equally important, even more important than OSCE, because 100 marks from two long cases and 40 marks from four short cases of ward rounds. So in total around 140 marks out of 300, that is about 50% of your practical weightage is from case vivas. How to prepare for that? I've already mentioned in previous videos. Just pick a single good clinical examination book. Don't try to read many different books and a lot of material, because it's not possible to revise in the last time. So just read a good clinical examination book and start with general examination and general history taking first. How to take history points, because usually a student gets stuck in the initial steps of a case presentation. It's rarely it happens that you reach to the final diagnosis, because viva starts from each and every initial point of your case presentation. Like even if you speak the name of your patient or whatever you say, viva starts from those all points. So in any clinical examination book you will find the first few chapters about the general points of history taking. So go through those points very nicely. Generally these days what we are doing, we are trying to read very complicated things and we are trying to just score bonus marks, and we are forgetting that these basics are very much important. So stick to the basics. What benefit you will get if you read basics carefully, that if any case is allotted, like a case of, let it be CVS, CNS, SAM, hematology, nephrotic, respiratory, GIT, anything, but the general case presentation pattern remains same. Okay, the history taking remains same, the points of history taking remain same, like how you have to start. You have to say who is the informant of this case in pediatrics, and the religion, from where the patient belongs, and all those points of origin, duration and progress of the chief complaints, how to write chief complaints. Even we commit mistakes. What is the correct pattern to note down the chief complaints? And most of the vivas end just around these chief complaints and the ODP, origin, duration, progress of that particular complaint only. So go through those points very nicely. Once you prepare these general topics, it is possible for you to give viva for any of the case, like let it be from any of the system. Okay, so first make it sure that you are well versed all those points after chief complaint and ODP, about what is the how to take birth history, family history, sibling history, diet history, vaccination history. You should not miss any of the point. Okay, and just be careful in history taking. Don't mention all those unnecessary points. There might be many points which patient relatives, mother, father says, but just first take it verbally. Don't just keep on noting everything, and then properly arrange those points what they are trying to say, because sometimes, and even difficulty is more when there is language issues, like you are getting center in a different state and the language is different, so for interpretation and everything. So first, in short, take history in short, just orally ask everything, and then note down the things which are very much important, because don't complicate your history taking, don't complicate your examination point, and just try to mention all those important points which are relevant for that particular patient, and for which you are also very much well prepared. Like what happens sometimes, we in a case of CVS or anything, in any case, we pay too much pressure to like symptom for complaint of constipation, and then your whole viva, the patient is from CNS or CVS, and then your whole viva goes towards constipation, and that complaint was not very much important. Constipation was from only last 1 or 2 days because of hospital admission or something like that. So just keep in mind about these things. Prepare general history taking and general examination scheme very well. Like for all the systems, the general examination points are similar, and the systemic examination is different for all systems. Like for CVS, for CNS especially, it's quite complicated. For RSGIT, they are different for systemic examination, but till general examination point, everything is similar. So you will feel confident definitely if you know very well how to do general how to take general history points and general examination, that okay, if any case comes, you suppose you have not prepared anything for hematology, you have never seen cases of leukemia in your PG days because your institute was not having that much patient load, and you have never treated a patient with leukemia, and suddenly you get a case of leukemia in your exam, then also just relax. You just take the history, general examination points, and then move on to systemic, because sometimes it happens, even I think in 30 to 40% or 50% of the students, that your case viva rarely progress to final conclusion or diagnosis. Okay, so don't feel depressed that you don't know about or you have not read about a particular case, because it's not definitely possible to read each and everything. So just concentrate on general history taking and general examination points, and then jump to particular systemic examination, and that too very properly for CVS and CNS especially, because these are definitely going to come as your long cases. Okay, thank you very much. If you have some doubt, you can post in comment section. All the very best for your practical examination. Thank you.